Anorexia nervosa. A person with anorexia nervosa might wake up in the morning already thinking about food, but not in the way most people do. Every calorie is counted, and every bite is planned or avoided altogether. The thought of eating causes anxiety, and stepping on the scale feels like a test they must pass. Even as their body weakens, their mind convinces them they need to lose more weight. Anorexia nervosa is an eating disorder that causes extreme food restriction, an intense fear of weight gain, and a distorted perception of body image. The brain misinterprets starvation as success, and instead of triggering hunger, it rewards self-denial. Over time, the body enters survival mode. Muscles break down, bones weaken, and the heart slows. Karen Carpenter, the legendary singer, battled anorexia for years. She restricted her food intake to a dangerous level, even as her health declined. Eventually, her heart, too weak from malnutrition, could no longer keep up. The obsession with control over food takes a toll on both the body and the mind, leading to serious consequences. Schizophrenia. Schizophrenia is a mental disorder that affects perception, thinking, and emotions. The brain misfires signals, flooding the mind with hallucinations, delusions, and paranoia. Even familiar places can feel unsafe, and everyday tasks become overwhelming. A person with schizophrenia might walk into a room and suddenly feel like something is wrong. The voices in their head whisper warnings, telling them people are watching. A simple glance from a stranger can feel like a threat. Their thoughts race, jump, and scatter, making conversations confusing, even with people they love. John Nash, a brilliant mathematician, lived with schizophrenia. He believed he was involved in a secret government mission, convinced he was being followed. Reality became twisted, and his own thoughts turned against him. Hallucinations and paranoia make it difficult to distinguish between real and imagined experiences, creating an ongoing struggle with reality. Bipolar disorder. One day, a person with bipolar disorder might feel unstoppable. They have so much energy, talk quickly, and jump from one idea to the next. Sleep feels unnecessary, and risks seem like opportunities. Then, suddenly, everything changes. That same person who was once full of life now struggles to get out of bed, unable to find joy in anything. Bipolar disorder causes extreme mood swings between mania and depression. During mania, the brain is flooded with dopamine and adrenaline, leading to impulsivity and recklessness. When depression sets in, those same brain chemicals drop, leaving behind exhaustion and sadness. The shifts can be unpredictable, making everyday life feel unstable. Demi Lovato, a famous actress, has spoken openly about living with bipolar disorder. She described how her manic episodes made her feel like she could do anything, but her depressive episodes left her feeling empty. The emotional roller coaster can make it difficult to maintain relationships, work, and a sense of stability. Major depressive disorder, MDD. MDD is caused by chemical imbalances in the brain, reducing serotonin and dopamine, the neurotransmitters responsible for happiness and motivation. This leads to persistent sadness, fatigue, and a loss of interest in life. Some experience physical symptoms, like headaches or body aches, with no clear cause. A person with major depressive disorder might sit in a room full of people and feel completely alone. They stop enjoying the things they once loved. And even simple tasks like getting out of bed, taking a shower, or making breakfast can feel overwhelming. They may sleep too much or not at all, yet no amount of rest makes the exhaustion go away. Robin Williams, despite his career in comedy, suffered from depression. Though he brought joy to millions, his mind pulled him into a deep sadness he struggled to escape. The weight of depression can feel never-ending, making even moments of happiness difficult to hold on to. Substance use disorders. A person struggling with substance use disorder may start with just one drink, one pill, or one hit to take the edge off. Over time, one isn't enough. The brain begins to crave the substance, convincing them they need it to feel normal. Soon, quitting feels impossible. Withdrawal brings unbearable pain, nausea, and anxiety, and the cycle continues. Substance use disorder affects the brain's reward system, making drugs or alcohol feel like the only source of pleasure. Dopamine levels spike during use but crash afterward, making cravings stronger. The brain begins to prioritize the substance over everything else: work, family, health, leading to a downward spiral. Robert Downey Jr., you probably know him from the Iron Man movie, struggled for years with addiction. Even when he wanted to stop, his body and mind fought against him, demanding more. The cravings become overpowering, turning something that once felt like an escape into a dependency that controls every aspect of life. Obsessive-Compulsive Disorder, OCD. A person with OCD might know logically that their hands are clean, yet they still feel the need to wash them again. The nagging thought won't go away, and the only way to ease the anxiety is to give in to the compulsion. But relief is short-lived, and soon the cycle begins again. OCD causes intrusive thoughts, obsessions, that trigger overwhelming anxiety, leading to repetitive behaviors, compulsions, meant to ease distress. The brain locks onto patterns, making certain actions feel necessary for safety, even when they don't make logical sense. David Beckham has spoken about his struggle with OCD. He feels a compulsive need for order and symmetry, arranging items perfectly before he can relax. The repetitive behaviors can take over daily life, making even simple activities feel exhausting. Post-traumatic stress disorder, PTSD. A person with PTSD might be going about their day when suddenly, a sound, a smell, or a passing face pulls them back into the worst moment of their life. Their heart races, their breathing quickens, and they feel like they are reliving the trauma all over again. PTSD develops after exposure to extreme trauma, keeping the brain in survival mode long after the danger has passed. The amygdala, the brain's fear center, remains hyperactive, making ordinary situations feel threatening. Flashbacks, nightmares, and emotional numbness make it difficult to move forward. Prince Harry has shared how his military experiences left him struggling with PTSD. Crowded places and loud noises triggered his anxiety, convincing his brain that he was still in danger. The body reacts as if the trauma is happening again, making it difficult to feel safe in everyday situations. It's never too late to prioritize your well-being. Subscribe and let's unlock a healthier, happier you. Neurocognitive disorders. Neurocognitive disorders such as Alzheimer's and dementia damage brain cells over time, leading to memory loss, confusion, and personality changes. As the disease progresses, even basic tasks become difficult, leaving the person disoriented and dependent on others for care. A person with a neurocognitive disorder might forget where they place their keys. Then, they forget what the keys are for. Familiar faces become strangers, and eventually they struggle to remember their own name. Ronald Reagan, once one of the most powerful men in the world, was diagnosed with Alzheimer's. Over time, he lost the ability to recognize even those closest to him. The disease slowly robs a person of their independence, identity, and connection to the world around them. Sleep-wake disorders. A person with a sleep disorder might lie awake for hours, their mind refusing to rest. Or they might doze off suddenly in the middle of a conversation, their body unable to regulate sleep properly. Sleep-wake disorders, including insomnia, narcolepsy, and sleep apnea, disrupt the body's natural sleep cycle. Sleep deprivation affects memory, mood, and even physical health, increasing the risk of heart disease and depression. This was a struggle for Heath Ledger, the late actor known for his unforgettable roles. Heath Ledger reportedly struggled with severe insomnia, relying on medications to help him sleep. His difficulty in finding rest led to dependence on multiple sedatives, ultimately contributing to his sad passing. A disrupted sleep cycle can have serious consequences, affecting both mental clarity and physical well-being. Anxiety disorders. For a person with an anxiety disorder, the smallest things can feel overwhelming. A ringing phone, a crowded room, or even an upcoming conversation can send their heart racing. Their mind jumps to worst-case scenarios, convincing them that something bad is about to happen. Anxiety disorders occur when the brain's fear center, the amygdala, becomes overactive. It floods the body with stress hormones, making even safe situations feel like threats. This can lead to excessive worry, panic attacks, restlessness, and difficulty concentrating. Emma Stone, an Oscar-winning actress, has spoken about her struggles with anxiety, recalling how panic attacks made her feel like she couldn't breathe. Even though she knew she was safe, her brain told her otherwise. The fear response takes over, making everyday situations feel like life or death events. Eating disorders. A person with an eating disorder might look at a plate of food and feel intense guilt. Every bite feels like too much, or not enough. Some eat until they feel physically sick, then purge to get rid of the guilt. Others lose control, eating large amounts in secret, ashamed of their inability to stop. Eating disorders, including bulimia and binge eating disorder, affect a person's relationship with food. The brain's reward system and self-perception become distorted, making eating feel like a punishment rather than a necessity. These disorders are often linked to emotional distress, low self-esteem, or a need for control. Princess Diana openly spoke about her struggles with bulimia. She would binge on food and then purge, caught in a cycle of guilt and distress. But the struggle isn't just about food. It's about control, self-worth, and deep emotional wounds that need healing. Dissociative disorders. Imagine looking in the mirror and not recognizing your own face, or suddenly realizing you have no memory of the last few hours. For people with dissociative disorders, these experiences are a frightening reality. Dissociative disorders cause a disconnect between thoughts, identity, and memory. They often develop as a response to extreme trauma, allowing the brain to shut off painful experiences. But that's not all. In severe cases, people may develop dissociative identity disorder, DID, where different personalities take control at different times. Roseanne Barr, a Hollywood star, has spoken about her experiences with dissociation, feeling detached from reality as a way to cope with past trauma. The mind creates a barrier to protect itself, but in doing so, it can cause memory loss, confusion, and a fractured sense of identity. Borderline personality disorder, BPD. People with borderline personality disorder often feel emotions more deeply than others. A small argument can feel like a breakup. A happy moment can quickly turn into sadness or anger. They might feel close to someone one day and push them away the next, afraid of being abandoned. These sudden mood shifts can make relationships and daily life hard to manage. BPD affects how people control their emotions. The brain reacts too strongly to stress, making feelings harder to handle. Many struggle with impulsive actions, like overspending, reckless behavior, or self-harm. Their sense of identity can also change often, making them feel unsure of who they really are. Pete Davidson, a comedian and actor, has spoken about his struggles with BPD. He has shared how his emotions can take over, making relationships and daily life difficult. Living with BPD can be challenging, but with therapy and support, many people learn to manage their emotions and build stronger connections. Thank you for watching. If you enjoyed the video, please consider subscribing and liking the video. It helps us out a lot.